Hi, my name is Dr. Perry Lin, and I'm a faculty member in the Department of Internal Medicine at Mount Carmel West, which is part of our Mount Carmel Health System. Today, we're going to be talking about test-taking strategies. Now, if you haven't already done so, what I would like you guys to do first is to go back and watch my video on study skills. If you missed the study skills lecture or you haven't been able to look through it or haven't finished it, it's very important that you watch that first. This is kind of the next step beyond it. Now, I know a lot of you are probably getting ready for tests or will be taking licensing tests soon, and you feel like all I need is the strategies. I promise you, if you don't have good study skills, these test-taking strategies will not make up for it. These strategies are to help you get over the small humps that you run into during taking a test, not to recall knowledge that you don't already know. So if you've already gone through the test-taking strategy lecture and have watched it, we'll start with study skills lecture. We'll start with test-taking strategies. So we'll start with the very basics on what we're going to go over today. We're going to talk about what to expect on a test. This is really important. We're going to be focusing specifically on the Internal Medicine Licensing Board. This, though, applies more broadly to any type of licensing test. We'll talk about what is tested, how questions are being made, how the people who write these tests and license people use the data that they collect from the test questions. We'll talk about how to approach answering a question. How do you break down a question? How do you go through a question and figure out what the correct answer is? Next, we're going to talk about strategies. That's going to be a big part of the very end of this lecture. I call them ninja strategies. These are basic, very easy strategies to use to increase your yield when you're quote-unquote guessing. I don't like to use the word guessing because it should never be an absolute guess. You should never be in a situation where you can't throw out any of the wrong answers or you can't rank the answers that are there in terms of probability, what is more and less likely. So we'll go over strategies on the best way to approach it when you don't know what the correct answer is right away. So what do you expect when you walk into a test? This is very important. Before you go in and sit down for any type of licensing test, especially the American Board of Internal Medicine test, you should know what your test is going to involve. You should know what's in the test. You should know how many sections it is, how many questions per section, how many breaks do you get, how much time do you get. When you end a break early between section 1 and 2, do you get to save that time for later or do you lose it? How much time do you have before the test to go through, learning how the process works and orienting yourself to the computer system? This is the important stuff in familiarizing yourself with the test. You need to know what you're walking into. If you don't even know that, the things that are going to trip you up on the test may not even be knowledge questions. It may be you didn't expect a section to finish that quickly because you didn't know you had X amount of time and should have finished each question in 1 to 2 minutes. Or it may be, your test started early because you didn't know that you only had a 5-minute break and you took a 10-minute break. These are very, very important things. If you don't know this information, you're just setting yourself up for failure. So before walking into any test, you should know exactly how that test is structured, set up, and on top of this, you should know where it is, how to get there, especially the time of day you're taking. If you're taking it, on a Friday morning, you need to understand that maybe traffic is a little worse on Fridays. If you're going to take it on a Friday afternoon, maybe everyone's leaving for work, to go home at that time, to get home for the weekend, and you're going to be stuck in traffic for 10 more minutes than you expected, and then you're going to be late for the test. Knowing how to study. We already went through the study skills lecture, but I want to reemphasize. You need to know how to study and you need to know how to read. If you don't have the knowledge base walking into the test, you could be the best test taker in the world and have the best strategies and know every single strategy, and you still will not do well on the test. Someone who's an incredible test taker, if you throw them into a test that they know nothing about, they probably will be able to beat the odds and do better than just pure guessing, but it definitely will not be close enough to passing the test. You also need to know the best way to study. The best way to retain knowledge is something I call the test, study, test, test strategy. This is also a strategy that's been published a lot of times, and a lot of academics talk about it who look at study testing techniques. They sometimes call it the test, study, test technique. What it is pre-testing yourself. Before you learn the knowledge, do a test. See what your baseline is. See what you don't know, see what you do know, and create those questions in your mind when you're actively reading so you know to look for those answers. You know where the gaps are in your knowledge. Suddenly you're studying that section and you realize, hey, I missed a bunch of those questions. Or hey, I had no idea what the answer to that question was. Now you're going to more actively read. You're going to focus your time on what you need to focus your time on. Then studying. Those are study skills, studying correctly, using the right highlighting or note-taking strategy. Like I said before, highlighting, no matter how well you do it, will probably never be as good as note-taking, but that doesn't mean it's a bad strategy. If it works for you, stick with it. And then finally, test. What this means is immediately after you're reading, you should be testing it. So within 24 hours after you study something, you should test yourself. That's why you have homework. We know that at 3 and 7 days, people have better retention when they're immediately tested on a concept within 24 hours than if they don't get tested on it until several days later. And the earlier you test yourself on the concept, the better your retention is. What is the second test? That is the review. We're studying for the boards, the American Board of Internal Medicine test. This is your licensing test. This is something you study over the course of years for. It's not something you study a week, 2 weeks, or a month for, which means that when you sit down for the boards, very likely one of the concepts you're being tested on is something you studied more than a calendar year ago. How do you ensure you remember it? You go back and regularly retest yourself on that concept. You redo test questions on that concept. If you think you're starting to forget it, you go back and review your notes. That's what that third test or the fourth word is for, just to remind you to go back and review concepts you've already studied. It's the same thing at the end of your test when you have a term test at the end of a semester or at the end of a year in a college class. You want to go back and review things that you've studied previously. And the best way to do that is as you're going through the year, going back and retesting yourself, actively on the concepts. You don't want to know a week beforehand that you completely forgot everything from the first half of the year that you studied. That is going to be a horrible situation because you are never going to be able to study that information well enough to feel confident walking into the test. Now, what is being tested? In the American Boards of Internal Medicine, they make it very clear. They have a website that I linked below that tells you exactly the percentage breakdown of the test. Think about it. They are licensing physicians. They need to have a standardized test to test people year in and year out. How are you confident in saying the person that took a test 5 years ago and got licensed and the person that takes the test today get licensed are both competent to practice medicine? The only way that happens is if you have a standardized testing system, which means that for the boards, there is a certain percentage of certain questions that show up. Cardiology is the largest section that shows up. Why is this important to know? If you're going to go study a section and you're going to, leave one of the MCSAP books till the end or one of the study books that you use till the end, are you going to leave the cardiology book till the end? Are you going to wait until there's a possibility that you might not have enough time to study? No, you're going to do the cardiology book early and you're going to review it often because it makes up the largest percentage of the test. The other things that make up large percentages of the test are gastroenterology, endocrine, infectious disease, pulmonary, rheumatology. These are all very, very important things to know. If you don't know what is going to be tested when you walk in the door, then how did you study? How did you prepare yourself? This is something that you need to do on day one. You need to know what you're walking into, and you need to know what to focus your time and effort on. How are questions written? This is also critically important. You need to know how test questions are written. Test questions are written in a very unique manner. If any of you have ever written a test question before, you understand how difficult it is to test certain concepts. You understand how difficult it is to test certain facts without giving the answer away. This is very, very important because if a concept is hard to test, then it's hard to create good validated test questions in a licensing test about it. That means that that concept, if it shows up, will only show up in a limited manner, or it may show up less frequently than you would have otherwise expected because it's a hard test question to validate. So how are board questions written in internal medicine? They start out with a testing point that they're going to choose. Then they build a patient around it. They don't start with the patient. They start with the point. What are we going to test them on? What is the concept? Now let's build a patient round. Let's add the age. Let's add the demographics. Let's add the sex. Let's add this other pertinent information you see in the stem of the question. Why is this important? Because it tells you how important that first sentence you read is. This is the next step of what they build. So if you're getting tested on something, the age, the sex, and the demographic, you better bet that that is really, really important stuff, and you better know what it is when you get to your answers. Then what do they do next? They add supporting information. They add lab values, history, physical exam findings, maybe even some images, some EKGs, x-rays, whatever it is. Why is this important? This tells you anything that's written in the labs or the history, whether or not it's a significant finding or non-significant finding, it is something that is very, very important and is going to be tested. So if something is normal, it's in there for a reason. If something is abnormal, it is in there for a reason. When they were creating the test question, they were either putting those supporting informations in there to help you answer the correct answer or throw out the wrong answer. That brings me to the very next line. Logical distractors are built into the question. So how do you write good, bad answers, right? You know, you look through a test and you land on maybe one or two answers. And those are ones that you say, I don't know. A and B both sound right. I don't know which one's more right. That's a well-written distractor. You want one that's going to throw people off. If someone doesn't truly understand the concept, they aren't going to be able to choose the right answer. That is the best logical distractor. Finally, you need to know how questions are validated and tested. This is really, really important in the boards. You are going to be tested on questions that will not end up in your final score. Why is that? Because the only way we can ensure good test questions exist is by trialing them in the population of people we are actually going to test. So, for example, if this beautiful test question is written and every single test writer thinks it's great, then they throw it out to the boards, and the first year you put it out there, 50% of the people choose a distractor you don't expect and get the question wrong. You need to go back to the drawing board and sit down and say, what did I mess up in that question? What did I put in there that threw people so far down the rabbit hole and down the wrong road that a good portion of people were choosing the wrong answer? This is the validation period of a test question. So this is why, which I'll talk about later, we tell people when you're studying for a board test, new recent information is never going to be tested because they have to not only create a question, they have to validate it over years. So it takes time to create a test question. Someone doesn't just go home, write up a test question, and the next day it shows up on the boards. No, what happens is someone creates a test question. They have meetings about the test question. They break down the test question. They make sure there are no issues with the question. They make sure it's a concept that they truly want to test. They make sure it's a concept with facts backing it up. Then they start putting it in tests, and they put it in tests year after year to make sure that people, a good percentage of people are getting it right, that people who get it wrong are choosing distractors for what appears to be the right reason. These are all really, really important in creating a great test question. So then by the time it actually gets tested, that concept came out years ago. How are you being tested? This is very, very important. In the boards, you are going to be tested on a two-step cognitive approach. They tell you that. When you go to the ABIM website where they bring up how they write a test question, they talk about the fact that they test you on a two-step cognitive approach. That means that they are going to test you and have you choose the first step and then take a second step to answer the question. So make the diagnosis and then choose the best treatment. Make the diagnosis and then choose the best intervention. Or identify the disease and then choose the next best test to further diagnose them. These are the steps they want you to take. It's not a rote memorization. It is not, what is 1 + 2? Okay, it's 3, I can answer. They're asking you to take another step behind that because they're testing you on your ability to be a physician. And what that means is you don't just need to be able to recall knowledge, you need to be able to take a concept, manipulate it, and then take a second step beyond that. So the two ways they're likely going to test you is discerning the diagnosis and finding the next best test, or discerning the diagnosis and identifying criteria for treatment. And we'll talk about this in the future. Why do they choose these concepts? There's a very clear reason why once you start breaking down test questions. So what about specifics? What are you going to be tested on? Let's just think about this from a reasonable point of view of a test taker. If I'm going to test you on an uncommon disease that shows up in 1 in a million people, am I going to show you an atypical presentation or a typical presentation? You're trying to identify people that can be doctors for a general population. Yeah, I would hope if a disease prevalence is 1 in a million, a regular PCP walking in the door who sees a common presentation is going to remember that disease and diagnose it. No, I do not expect a PCP who comes in with, an uncommon disease process that, comes in 1 in a million, and the patient is presenting as only 5% of those patients present. That is so incredibly rare. I wouldn't expect every single doctor to know that. That is not the minimum criteria I'm going to set to be a physician. What I'm going to set is they need to be able to identify uncommon diseases. Now, what about common diseases? Something that happens with a prevalence of 10, 20% in your general community, yes, you better darn sure well know what the uncommon presentations are. Something that is common will show up uncommonly in terms of presentation on your test. So that's something to remember. If you're answering a test question based on an uncommon presentation of an uncommon disease, you probably got the disease wrong. That is something to always remember. You're only going to be tested on uncommon diseases presenting commonly and common diseases presenting uncommonly. Finally, the third point, value-based medicine. I only have 3 points on here. The reason value-based medicine is on here is there has been a huge national push to decrease healthcare costs while providing better patient outcomes. How do you do that? You use value-based medicine. You give them the best treatment at the best time with the best diagnosis, using the best diagnostic criteria. Don't use an MRI when an X-ray will do. You want to go with the best next step, and that typically will be value-based medicine. So you're going to see a higher percentage of questions asking you to not only discern the best next test, but also to understand that one of those are probably the answer because of value-based medicine. Now here's the next topic that you really need to know well when you're walking into a test. How is this test being used? Every single one of you took the ACT. Every single one of you took an SAT. What is that test supposed to do? That test is supposed to discern among the general population how intelligent and how smart that person going into college is. It helps colleges rank their applicants in an objective measure. Not every high school ranks their students in the same way. Not every teacher ranks their students in the same way. So how do you tell student A from one state from student B from another state? You use a standardized test, which means that that test has to be developed to not only discern out where you rank, but really differentiate out the top 1%, the top 10%, the top 20%. Differentiate out the bottom 30%, the bottom 20%, the bottom 10%. How is your licensing test going to be used? It's going to be used to figure out what the minimum criteria to practice medicine is going to be. They don't care about identifying, differentiating between who's number 1 in the nation and who's number 2. Who's in the top 1 percentile and who's in the top 3 or 4 percentile. Yes, you will get a percentile rank, or you'll know how you score compared to the general population who take this test. But no, this test is not created to differentiate out the best of the best or the worst of the worst. All this test is done is to create a minimum criteria to practice. What do you need to know to be able to safely practice medicine? What this means is that there has to be a gradient of difficulty. Yes, there are going to be hard questions, but yes, there are also going to be a significant amount of easy questions. Don't get thrown off by that. If you see a real easy question testing a real easy concept, don't think that they're trying to fool you. They need to know that that person who's straddling the edge knows enough knowledge to adequately treat and safely treat a patient. The only way to do that is if you happen to be one of the smartest people in the room, there's going to be easy questions. If you happen to be the average doctor in the room, there's going to be easy questions. Now, if you happen to be, the lowest and the worst and doctor in the room, which I hope none of you are, yes, you may not recognize any easy questions. Very likely you're not going to pass this test. But there are always going to be easy questions as a generality. Algorithms and mental shortcuts. This is important because from my first lecture about study skills to this lecture here, The first lecture is all about how you come up with a method to do something. Algorithms and shortcuts make you great clinicians, but don't make you great test takers. I'll say that again. They make you great clinicians, but poor test takers. Why is that? The doctor that can go downstairs and see a patient in the ED and off of an algorithm or a mental shortcut because they saw this disease process before, immediately recognize a very dangerous disease process, verify it with a test, and then treat them quickly is going to have a better outcome than the physician that goes downstairs and doesn't recognize that algorithm or that mental shortcut very quickly. It also sometimes gets that first doctor in a little bit of trouble if you have an atypical presentation. But it makes you a poor test taker because what you're doing as you're going through the question is you're starting to throw out stuff that you're reading. You're trying to fit a patient and push them into this algorithm. You're going to say, oh, but this lab isn't typical. Okay, we'll just say, XYZ happened. That's why that lab is bad. You're going to explain it away. What you need to remember is in a test, every single word is there for a reason. Every number is there for a reason. Nothing should be thrown out. Nothing should be explained away. If it's written down on the paper, it's there to tell you something important. So, do not use the data to support your answer. Use the data to find your answer. What that means is after you read the first sentence and you're going through the question, you shouldn't have an answer in your mind and then be trying to plug in that data to fit that algorithm. No, what should happen is you should be analyzing all the data. It should be coming in, you should be acknowledging it, and you should use that to constitute an answer. How do you approach a question? The easiest way to do this is to know the parts of a question. So in the boards, they very clearly tell you what the parts of the question are. Every single question is written the same way. First, there's a STEM. This gives you the demographic information and the chief complaint. This is important because if you remember when they're testing a concept, what is the first step they do? They build the demographics. And that's the first sentence in your test question. Yes, that information is important. You better darn well know it. What's next? The HPI. They give you history that support or refute the answer. They're not going to fill a history section with a lot of useless information. Every single word that is there is to help you choose the right answer or to tell you why a wrong answer is wrong. Next, the physical exam. Exact same thing. They aren't going to give you a full physical exam every single time. They may for a few questions. They're going to give you a focused exam. So if they talk about a specific system, that system is being talked about for a certain reason. If they give you a physical exam finding, it is there for a reason. It is either there to help you find the right answer or help you throw out a wrong answer. Labs, imaging, EKG. Not every single question is going to have labs. Not every single question is going to have imaging, and not every single question is going to have an EKG. So if they present labs that you typically don't see, like an ANA or CCP, you better darn well look at it and understand why that's there. If they give you an X-ray, you better understand why it's there. If they show you a picture from echo, you better actually look at it. Same thing with EKGs. If it's not something that's typically given in every single question, then it's definitely there for a reason. It's to help you choose the right answer or throw out the wrong answer. And it is very likely that the way to choose the right answer, that crux, is in that extra piece of information. They're not only testing you on your fact, but testing on your ability to read an X-ray, an EKG, or to interpret certain labs. Now, you're sitting at the test. How do you approach the test question? Do you read it top to bottom? Do you read the answers first? What do you do? I'm going to walk you through the most efficient and ideal way to go through a test question. We'll explain why we do each step the way we do it. First, read the lead-in. You need to know what's being asked of you, or else you can't really answer the question. Why wait until the end of the reading to know? If they're asking you for what is the next best test, what is the next best treatment, what is the next best medication to use, don't you want to know that information before you start reading about the question? Next, glance at the choices. This is really, really important. A lot of people, when they're using tests as a study skill and a study technique, are asked to read the answer choices in detail. You should not do that at the beginning because you're going to do it at the end anyways. Why repeat work that you're going to do? But yes, you should know what the answer choices probably are. You should know that if they're testing you about the next best step, one is a medication, two of them are imaging studies, and another one is an intervention. You should know that they're testing you about multiple modalities, or you should know that all four answer choices happen to be medications. That gives you information. Are they testing you about side effects of medications? Are they testing you about class effects of medications? Glancing at it and having an idea of what the answer choices are helps you. Reading it in detail doesn't help you any further at that point at the beginning of the question. So next, read the STEM. Read that first sentence in detail. Focus on the demographics. Focus on the extra information that they give you. Then read the rest of the question. And then focus on the atypical information. Like I just said, if they give you an image, an EKG, a photo, or an atypical lab, read it, understand it, know what's there. What are they trying to get you to take away from that? Know what that takeaway is from that piece of information. Next, reread the lead-in. Read that question again. Did you get it right the first time? Are you going down the wrong path? Did you think that they were testing you about the next best step, but they were actually, testing you on a slight variation on the theme? You need to reread it, and then finally read all the questions. This is the time you go through and read each question in detail. Read every word of every question. Just because you think answer A is correct doesn't mean you don't read A, B, C, and D. You need to read all the questions or all the answers before you know which answer is correct. Because very well, A may be a great distractor and B may be a better answer. And you completely missed it because you chose A and you moved on and didn't read the rest of the answer choices. Now the STEM. I'm going to focus on this a lot. Why is the STEM so important? Because that's the first step. Once you've developed what concept you're going to test, the STEM is the first step of building a question. So they will give you a lot of valuable data. Yes, it's one sentence, but that sentence is jam-packed with important information. It'll tell you key points such as demographics. Not every patient will fit the correct demographic, but that will only happen really in common disease processes. Common disease processes presenting uncommonly, yes. Think about atypical presentations. But if they're going to be talking about an atypical disease, an uncommon disease, they're going to give you an atypical presentation. Look for non-typical information. That sentence is always going to give you an age, sex, and some sort of demographic marker. But if they give you an occupation, they tell you where they live, they tell you that they've been traveling or activities that they enjoy doing, you better think about it. They're telling you someone's coming from the desert Southwest and it's a question about a fungal disease, you better be thinking of coccidioides. You need to be able to understand why that information is in there. Next, focus on descriptors. This is also critically important. There are certain things that are pathognomonic for diseases, and you better know what those are. Some descriptors will help you focus on. If someone's complaining of tearing chest pain, a barking cough, or for derm, they're telling you there's clearly demarcated borders. Those words are in there for a reason. You better acknowledge them and know that they're there, and you better use those words to help you find the best answer. So, active reading. What does that mean? At some point in all of your career, someone has told you test questions are a great study skill. I completely agree with that. But there is a way to write test questions as a study skill and to help people study, and there's a way to write test questions to help people understand knowledge. That's why when you're studying for a test, there is a difference between the questions that come up at the end of any type of review book, and then the quote-unquote mock test that they give you. That's why when you're studying, for example, for the boards, most of the review material gives you questions that are not representative of questions you see on the boards, because they're using that question as a study skill. You should focus on every answer and know why the wrong answers are wrong. But when you're taking a test, that stuff slows you down. They tell you things like anticipating the answer. As you're reading through, you should guess what the answer is going to be. You shouldn't do that for a test. You should be more open-minded and use the facts that they give you to support an answer, not try to guess the answer and say, oh, are they going to tell me this fact? Anticipating wrong answers, great study technique. As you're going through and they give you a fact, you say, oh yeah, they're trying to throw me off with this piece of information. When you're using a test, don't waste that little bit of mental time to identify why that piece of information is given there and what the wrong answer probably is going to be. Just acknowledge that it exists, and as you're going through the answers, be able to say, hey, I have this piece of knowledge, I know that's wrong. Because what if they give you something to rule something out and then they never ask about it in the question stem? Or what if that piece of information can be used in one of a myriad of different ways, and they happen to utilize it in a way that's not to get the wrong answer, but to help you choose the right answer. Then you're kind of wasting that cognitive power on something that's not going to help you answer the right answer. So ultimately, what I want you to take away is this very last line. Anticipation and trying to guess the right answers and wrong answers are asking you to use an algorithm and mental shortcut. And as I said before, those are poor test-taking strategies. Don't use those, because test writers know what the algorithms are and mental shortcuts are. And they may try to throw you off with that very thing. They may try to use what you're trying to use to answer the question against you. So you should be using the whole question, every single word that's written in there. And there aren't many words written on the board questions, so you should be able to use every single one of those words to help you find the right answer. Approaching the answers. You need to know before you get to the answers what point is being tested and what point is being asked. You also should know the first step of that two-step cognitive process. If the test question and that lead-in is asking you, what is the next best treatment? You better know what the disease process is. If you don't know what disease they're testing you on, how do you know what the treatment is going to be? So when you get to that point where you're answering the questions, you should already be at the first step. Because if you don't know the answer to the first step, you can't answer the second step. Read every single answer fully. Like I said before, every single answer has important information in there. It may just be one word that turns a correct answer to a wrong answer. As you're going through the questions, eliminate clearly wrong answers. When there's a very obvious wrong answer, get rid of it. And then you could ignore it and not think about it. If you're choosing between two answers, don't go back and say, oh, which one did I think was wrong again? Next, and this is important. This is why it's on this page and shows up later. Your first choice is the right choice. If you are going through and you choose B and suddenly say, no, I think it's C, stick with your first choice B. Statistically, your first choice tends to be the correct choice. When people change their answers, on a whole, statistically, they tend to get those questions wrong more often than right. Your first choice is the one you should stick with. The only reason you should ever change your test question is when there was a very clear error made. Oh, I didn't realize that was what this EKG is showing. I didn't realize that was what this lab was. Now that I look at the question again, I realize I completely missed something they were trying to hint at. Yes, then you should change it. But if you're just kind of guessing between B and C, and you go back and review the question, and suddenly you feel C is better, and you switch your answer because of that, you probably are switching from a correct answer to a wrong answer. Don't try to reason out exceptions. Don't try to create this convoluted story about why a certain fact was placed in there. Oh, they put this EKG in there because sometimes people with this disease process have this happen and then this happens and this happens, which leads to this EKG result. No, if they don't tell it to you in the test question, that is the world you're operating in. If it's not in there, you can't assume that it's part of the answer. So if there is a piece of information that doesn't fit your correct answer, you better darn well know why that's there. So finally, we're going to move to what I call ninja strategies. These are the strategies you can use when you're down to one or two answers and you don't know which answer to choose. So first, like I said before, in the study skills and test-taking strategies, there are going to be obvious right answers. Not all test questions will be two-step reasoning processes. Some will be recall of facts, and if you know the fact, you know the answer. This is a test of a minimum ability to practice medicine. This is not a test of who is the best doctor in the room. Therefore, there are going to be easy questions, and there are going to be a good amount of easy questions. So if it's an obvious answer, it's likely right. Don't try to over-reason a question and get it wrong because of that. Identify how answers are grouped. So you will see grouping in terms of 4 medication choices, 4 imaging choices, Obviously, then what they're asking you is which is the best medication or which medications have contraindications to them. For the imaging, they're probably asking which is the best first step, or do they have any contraindications to certain imaging tests. This is very, very important because if multiple similar medications within, say, same class are given to you, they're probably testing you about a side effect of that specific medication. If there are multiple classes given to you, they're testing you about contraindications to certain disease classes. If there are multiple imaging modalities, they may be asking you about sensitivity or specificity, or they may be asking you about absolute or relative contraindications to certain tests. Next, if there are partially right answers and you're using a conditional quality, then you're wrong. If you say this answer sounds right, but it would only be right if XYZ were to happen, and they didn't tell you XYZ happened, that is a partially correct answer, and that is a wrong answer. There is a better answer written in there, and that is likely the correct choice. If there are multiple similar partially correct answers, then both are probably wrong. If they give you, let's say, 2 medications, 1 intervention, and an imaging test somehow, and those medications are both partially correct, the answer probably lies in the intervention or the imaging study. If they're opposites, one is likely correct. It's important to remember. It's hard to write a question in which 2 completely opposite answers are both wrong. Yes, that can happen. I can tell you in writing test questions, that is pretty hard to do. Usually if there are 2 very radically opposite answers, one is right and one is wrong. If there is always, never, or every written in the answer stem, then it's probably wrong. That's a test skill that almost everybody tends to know. It's one that a lot of people talk about. And especially in medicine, very rarely does something always happen, never happen, or happen every single time. There's always exceptions to the rules. So if they use those words, then they're probably the wrong answer that you're reading. If you're relying on a recent study, you are definitely wrong. We went over how long it takes to write a question. If a study just came out 6 months ago and it's radically new information testing you on something specific, and you see a test question, you're saying, well, based off of this study with this exception, this answer would be right. There's no way they wrote the test question, validated it, and put it in the test in time. You may be seeing a question that's getting validated. In that situation, whether or not you get it right or wrong won't matter. What you should focus on is the fact that if you're using a very recent study, you're applying the wrong type of knowledge to answer the question. If you're relying on controversial information, you are wrong. I wrote that as a definite. It's more of a conditional type of situation. Why would they write a test question about something that's controversial? Let's say there's a controversial topic in medicine, and some people agree, some people disagree. And a study has come out, and right now the pendulum is leaning towards one side. If you write that question, and you validate it, and you spend years and time and money and effort working on it, and suddenly a new study comes out and completely contradicts the answer that you chose, didn't you just waste a lot of time, money, and effort? Why would they spend their time testing you on a controversial topic? There's plenty of non-controversial topics to test you on. They aren't going to spend their effort choosing a topic that's controversial. So if you're relying on what is controversial information, then you likely are going down the wrong road. Questions are written and validated over years, so it's kind of like the recent study idea. If there's this new recent landmark study that's telling you with something that changes how we treat a certain disease process, it probably won't show up on the boards that year. It probably won't show up the year later. And the lead time is going to be roughly around 3 years. At about 3 to 5 years, you're going to start seeing that question pop up. And like I said before, why would they waste time testing a concept that could be proven wrong? So if there is a new study out and it's based off of a new medication and we aren't quite sure exactly what it does yet, they aren't going to test you on it until they get to the point that they're confident. The best example is COX-2 inhibitors. When COX-2 inhibitors got FDA approved and came out, they were probably writing questions about it. Suddenly they get taken off the market, or the vast majority do. Now they're stuck in the situation. They have a bunch of questions that they can no longer use because suddenly it's not something that people use regularly anyways. And if they do test you on it, they probably are going to test you on why it was taken off the market. So a lot of times very, very new things are not going to be tested. And even when they start trickling in at this quote unquote 2 to 3 year mark, it may be even later because they may want to wait to see if everything bears out the way it's supposed to. If you're trying to reason why data doesn't fit, then you have it wrong. If you come up with an elaborate story on why this person looks like they have heart failure but don't have heart failure because of XYZ, none of which was told to you in the question stem, you're going down the wrong road. You need to take everything that's written as gospel. If they tell it to you, it happened. If they didn't tell it to you, it's not relevant to the answer. If they tell you someone did something, they did something. Next, I don't really like telling people this, but it is a fairly decent test-taking strategy. When you are completely lost and you don't know what to do and you can't rank your answers into most likely or least likely, or you can only throw out one wrong answer, the answer that is the longest with the most information is more likely to be correct when you're purely guessing. That's not going to be true significant enough for you to be able to guess on a large portion of the test and still be able to pass. However, that can help you on a couple questions and raise your probability of guessing above chance. If you were to ever write a test question yourself, you'll realize why this is true. Writing a correct answer takes more words than writing a wrong answer. Typically, a wrong answer can be written really effectively by omitting information. A right answer sometimes needs conditional qualifications to be correct, which means it becomes a longer answer. So as and I encourage each of you, sit down and try to write test questions. You very quickly realize that if they're testing you about a certain concept, there's only certain ways to test it. There's only certain ways to invent the wheel. And they may really, really badly want to test you on some random part of a concept, but it doesn't lend itself well to test questions. That may be a question that never ends up getting validated. Finally, for keywords, think about rare diseases. When they give you a specific word, a demographic, a location, an occupation, they are asking you to make that jump to a disease process. When you hear Ohio River Valley, you think histoplasma. Don't think that they're trying to throw you off and send you down a rabbit hole by giving you Ohio River Valley. Now, yes, it would be mean, they may do that, but that would be a hard test question to validate. When they're giving you that specific piece of information, they probably want you to recognize what disease is associated with it. Now, high yield areas. What should you focus on? The week, the month, you're coming up onto the test date and you're trying to figure out, what do I need to study? I've already done everything that I need to do. Well, I got a week left. What should I focus on? This is what you should focus on. Uncommon features of common diseases, common features of uncommon diseases, demographic correlations, formulas, and this is important, simple gaps and gradients that you should be able to calculate in your head, they will expect you to calculate. So yes, you should know equations. No, if you have to sit down and do very complex math to figure out an equation, they're not asking you for that answer. If they give you something, the numbers will work out easily and simply. Sometimes that answer may be barely above what the cutoff is, like a SAG, for example. It may barely be above 1.1. And what they're testing you is not, if you can do the math, they're testing you if you recognize what the cutoff is. They're going to test you about simple statistics, sensitivity, specificity, positive predictive value, negative predictive value. Yes, you will be tested in more complex ideas in statistics, but those four are easy to make test questions and easy to test. So those are definitely going to show up. Adverse effects of medications. It is so easy to write a test question with contraindications to medications to throw out wrong answers. If you think about it, all you have to write in their history is they have disease X. And if that's contraindicated for a certain medication, suddenly you have a perfect wrong answer. Those are great and easy wrong answers to write. Value-based medicine, treatment guidelines. This is where medicine is headed. This is the future. This is how we are going to treat patients better in the future and get better outcomes with less cost. So they are going to test you about it. They're going to test you if you understand what treatment guidelines is. If there is a clear guideline about a disease process, you better know what that guideline is because they will test you on guideline medicine. If there is a very clear test that is the right answer for value-based medicine, they will test you on that. So what I hope you took out of this whole lecture is next time you walk into a test, when you walk into the board test, you not only know what to expect and how much time and what the weight of each section are. When you get to a question, you know how to break it down. What I want you guys to go home today is as you go through practice questions, I want you to break down the questions. I want you to approach questions in the way I asked you to approach them. And then I want you to see if you can identify what is the key concept they're testing you. Those of you that work with me on board prep know I ask all the time, break down the question. Tell it to me in one line. Because when you write a test question, you are testing one concept. If you know what concept they're testing you, that answer is easy to find. And I'm hoping the ninja strategies I gave you help you narrow down the answer when you don't know the correct answer. You should never, quote unquote, guess. You should never be in a situation where you have to blindly guess what the best answer is and just choose a random answer. You should be able to at least narrow it down to a more likely or less likely answer and choose the more likely answer. I hope all of you got a lot out of this lecture series, and we will be doing more in the future based off of the feedback and what people are asking for. So keep an eye out. There's going to be more lectures coming up. Thank you.